Copyright 2018. Wolters Kluwer. Chapter 14. Preparing a Family for Childbirth and Parenting. Childbirth Education, Childbirth Educators. Childbirth Teaching Methods. Efficacy of Childbirth Education Classes. Nursing Care Planning to Respect Cultural Diversity. Preconception Classes. Expectant Parenting Classes. Sibling Education Classes. Breastfeeding Classes. Preparation for Childbirth Classes. Pain Management Education. A woman needs to come into labor informed about what causes labor pain and prepared with breathing exercises to use to minimize pain during contractions. A woman experiences less pain if her abdomen is relaxed and the uterus is allowed to rise freely against the abdominal wall with contractions. Using the gating control theory of pain perception, distraction techniques can be employed to alter how pain is received. Birth setting education. Woman's health and that of her fetus. Couples' preferences. How much and what kind of supervision couple wants for birth. 2020 National Health Goals related to preparing for childbirth and parenting. Increase the proportion of pregnant women who attend a series of prepared childbirth classes. Developmental. Increase the proportion of pregnant women who receive early and adequate prenatal care from a baseline of 70.5% to a target of 77.6%. Increase the proportion of women delivering a live birth who received preconception care services and practiced key recommended preconception health behaviors. Developmental. Assessing a family preparing for childbirth and parenting. Nursing diagnoses, preparation for childbirth and parenting, health-seeking behaviors related to learning more about childbirth and newborn care. If there is a lack of a support person. Ineffective coping related to lack of a support person. Anxiety related to absence of significant other. For a couple unable to make a decision about a childbirth setting. Decisional conflict related to lack of information about advantages and disadvantages of various childbirth settings. If there are older children in the family. Anxiety related to sibling role in pending birth event and sibling ability to welcome new family member. Nursing care for a family preparing for childbirth and parenting. Prenatal exercises. Prenatal yoga. Perineal and abdominal exercises. Tailor sitting. Squatting. Kegel exercises. Abdominal muscle contractions. Pelvic rocking. Tailor sitting. Squatting. Pelvic rocking. Nursing care for a family preparing for childbirth and parenting. Pain management methods. Bradley, partner coached. Psychosexual. Lamaze philosophy. Dick Reed. Lamaze. Conscious relaxation. Cleansing breath. Consciously controlled breathing. Effleurage. Focusing. Second stage breathing. Lamaze. Conscious relaxation. Cleansing breath. Consciously controlled breathing. Effleurage. Focusing. Second stage breathing. Breathing patterns during a single contraction. Effleurage patterns. Birth setting. Hospital birth. Alternative birth center. Home birth. Alternative birthing methods. Lieboyer method. Birthing room is darkened. Soft music. Infant placed immediately into warm water bath. Hydrotherapy and water birth. Unassisted birth. Woman with unique needs. Disability. Cultural concerns. Morbidly obese. Question: you are assisting a woman to evaluate the available choices for managing her birth experience. The woman reports her priorities include gaining as much information to prepare her for the birth, an interest in relaxation techniques, and a desire to include her partner in the birth experience. Which method of childbirth techniques will be most accommodating of her wishes? The Bradley method. The psychosexual method. The Dick Reed method. The Lamaze method. Answer C. The Dick Reed method. Rationale: the Dick Reed method is based on the premise that fear leads to tension and, later, pain. If fear is combated, tension and thus pain is avoided. Question: you are at a sports event when a woman begins to give birth. You volunteer to assist until further help arrives. The infant cries immediately and is not in obvious respiratory distress. Which would be the best action following delivery of the placenta? Cut the cord using a flamed pocket knife. Place the infant on the mother's abdomen. Hold the infant with head elevated. Encourage the infant to breastfeed. Answer: D. Encourage the infant to breastfeed. Rationale: breastfeeding causes the release of natural oxytocin, helping to contract the uterus and minimize bleeding. Question: during a home birth, which of the following times is one of the most dangerous periods for the mother? Crowning. Transition. Early in labor. Following placental delivery. Answer D. Following placental delivery. Rationale: if a uterus becomes uncontracted in the first few hours following childbirth, bleeding can be extreme. Without a healthcare provider to monitor her, a woman can fall asleep from exhaustion and allow hemorrhage to occur.